Dan Smith, Director of Sports and Spinal Physio here. So today I've just discharged a professional tennis player that had shoulder impingement. So I thought I would come on here today and have a chat with you all about this particular problem, explain what shoulder impingement is and what we can do about it. So first of all, let's just talk about the shoulder itself. The shoulder is essentially a ball and socket joint. It's made from the shoulder blade, which is called the scapula, and you have the humerus or the arm that plugs into it, and you have the collarbone at the top here. Shoulder impingement occurs when this space where my finger is here, under the sort of end of the shoulder blade, becomes narrowed and compressed. As a result, the tendons in this part become inflamed and swell up, and you get shoulder pain. Now, this problem can be quite painful. It can be very limiting in terms of what it can do, so it can prevent you from playing sports, it can prevent you from dressing, it can prevent you from doing your DIY or your housework. It can become so painful that actually it can lead to other problems as well. So some people go on to develop frozen shoulder, which is a really nasty condition that lasts up to a couple of years and can need surgery. Good news is that if this is managed correctly with the right treatment, we can fix the impingement and we can stop the pain. Now, studies have recently shown that exercise over 12 months compared to surgery has the same outcome. So what this suggests is that you don't really need the surgery, you just need to invest in your own body through doing some specific exercises to correct the problem. So what do we need to do? First of all, we need to assess the shoulder blade, because quite often this is dysfunctional in terms of how it works and it narrows the space. So assessing this position and assessing how it moves when the person moves their arm is the first thing. Once we know what's wrong with it, we can address it with specific exercises to change the muscle function around the shoulder to make the shoulder work in a different way so that the shoulder doesn't keep impinging here. Second, we need to look at restrictions. So sometimes there are restrictions that occur around the shoulder that mean we compensate, and those compensations cause us to develop the impingement and the pain. So getting rid of those stiff bits or tight bits in the muscle can really help to make the shoulder function better and lessen the impingement. So once we've assessed these areas, we provide our patients with a longer term program they continue to work on that keeps the shoulder functioning as it should do and stops them from developing impingement further down the line. And in most cases, this gets them back to things they love. And in my professional tennis players' instance, got him back to playing professional tennis again. So I hope this has been useful for you. And if you've got any comments or you'd like to ask us some questions about shoulder impingement, please don't hesitate to get in touch, private message us, or email us via our website. This is Dan Smith, Director of Sports and Spinal Physio, saying goodbye.